Okay, guys, real quick, I'm just going to start, introduce people, and then I'm going to let the people you actually want to hear talk. You guys hear me talk a lot. Before we do that, I just kind of want to give you the reasoning behind True Velocity and why we started it, and then I'll hand it off to these guys to explain exactly what it is. So, initially, we obviously saw the need for people to throw harder. I mean, obviously, it's one of the biggest parts. We're here to get everybody recruited, and it's one of the most important things that you have when it comes to that. So, Hector and I started working on a program and implementing. Are you good?
I don't know, you buy this stuff?
We started implementing a program that was working, but we weren't packaging it up and like selling it. We were just doing it with some of our guys. Another group across town was doing a really good job of marketing a velocity program, and so we had several guys going over there and coming back hurt. So at that point in time, we sort of partnered up with Boost and started figuring out a way to make sure we can keep guys healthy while still getting them to throw hard. So that's the genesis. That's how it all started. That's how we started really digging in and putting the program together. So now the program actually includes doctors, as you know, the PTs, and their screening and making sure everybody's healthy. One of the biggest things at the beginning is that you pass markers that we know we can make you do these things without hurting you. So with that, I'm going to pass it on. Kyle is our trainer for True Velocity. He's going to talk about kind of what they do, and then we'll just hand it on down the line and go from there.
My biggest goal in the True Velocity program isn't just making these kids stronger and faster, but keeping them injury prevention. Teach them how their body should work, how it should move through different exercises. Not just so when they're in here, they're lifting properly, but when they're in school, 24-hour fitness, whatever it is, they're performing those exercises properly as well. The biggest goal is obviously increasing their velo, but not just increasing their velo one time, consistently pitch 1 through pitch 60. Keeping that stamina all the way through while being pain-free all the way through their innings pitch. With that being said, there's a lot of difference, even little exercise and mobility, strengthening that we have to do before they ever get to lift heavier weights and really work those kinetic chains. With that, I mean, that's all I'm gonna say. With that being said, I'm gonna pass it off to Chris, and she's gonna talk more about the PT side, and Sam as well, to my left.
Hi, my name is Chris McLagan. I'm the marketing director at Boost, and obviously the parents love to hear about injury prevention and keeping your players and keeping your kids on the field. But you guys who are sitting here who are players, you should be thrilled to hear all of this, because not all clubs focus on injury prevention, and that should make you happy. Everybody here, you'll hear the same thing from everybody up here. We would like to keep you injury free, but if you do get injured, because it does happen, then you've got the resources right next door to help to get you back as quickly and safely as possible. Something that we offer as part of our arrangement or agreement with your club is we offer a free injury consult, and that is something that anytime you're over here and you feel something's injured, and you talk to your coaches and you need to come over and see Austin or Sam, they will work with you and get you back quickly and safely, but they'll give you some direction. Maybe they just need to perform exercises, or maybe you need to see somebody. Whatever the case might be, these two are an amazing resource for you guys. I'm going to pass this off to Sam, and she's going to talk a little bit about the screenings.
I do too. So I'm Sam. I'm the PT next door, Austin PTA that works with me. I pretty much live next door, so at any time that you guys come after school over break, if it's kind of during that 7 to 6:30 time, I'm usually there. Depending on what patients we have, like we may have to schedule the consult at a time that works around who's already in therapy, kind of receiving therapy, but I can at least look at you and let you know, okay, you slightly strained this, you need to be careful with this, or if you need to completely take a break from hitting, from running, from working with Kyle, whatever it may be, so that you can move forward without further injuring yourself. In addition to those screens, we're also doing, I'm helping with the screens that Kyle's doing for the pre-screens and the post-screens for all the true velocity stuff. One thing we discovered so far with the first round, you guys, pain is not normal. If you are having pain throwing in your elbow and your shoulder every time you pitch, it's not normal. I know a lot of you kind of like just like, oh, I'm pushing through, it's not a big deal. There are a lot of little things that you can do if you are telling people that can get rid of that pain and then make everything else in your life easier. So you have to be laughing right now because you are probably those people. When we do these screens, we kind of look at some gross movement patterns just to see if you have really tight hips and you can't follow through with your internal rotation as you're throwing, that's going to impact your shoulder, going to impact your elbow, can make your back hurt. The entire chain up, it starts impacting other things. So it's little things that Kyle can tweak in working with you, little things you guys can work on while you're here in the club. All of those can make other pains go away that you have lived with for years. So make sure to tell people we are not scary, I promise. I know a couple of you in here already. Hopefully you guys say good things about me. I think that's all I have to say, but any, including parents, can come over for screens too. So if your kids are making your neck hurt from headaches, it doesn't have to be the kids that come in too. So I think that's about all I have. Okay.
Real quick, so you've already heard two people talk about the kinetic chain. This is something that we focus on a lot. The goal with the throwing piece is to build the velocity from the ground up. Too many of you guys just think it's an arm thing. We got to throw harder, so we just try and throw harder. The big thing that we work on here is to get you to understand the feeling that you get from starting with your legs, working through the entire kinetic chain to where your arm is not under stress, okay? So the master at that is Hector, so we'll hand it to him. He's probably gonna go a little bit longer than the rest of us, but here you go.
Hello guys, my name is Hector Garcia. Some of my players are already laughing at me. First because my main priority just make sure that they're doing what they're supposed to be doing first and foremost. And in order for them to throw hard, I just yell at them in Spanish. Start calling them names, but no, that's not it. When Jeff and I talk about true velocity, our idea was just to make our athletes better off the field and how can prepare themselves to get ready to throw. One of the things that I got very irritated, especially from the youth level all the way to high school, is I see the players, first thing they do is pick up the baseball and start throwing. And it's just something that they didn't know. They didn't realize that they have to get their body ready to throw before they even touch the ball. I can guarantee you from professional level, they don't even want to touch the baseball until they know they feel ready to throw the baseball. But in that DNA, so we normally have that backwards. So that's one of the things that we saw here at the facility that we can implement. So we're starting doing some dynamics work. We talked to Kyle. Kyle kind of teaches us how to do something better to get them ready. And then Jeff kind of talked about with me and some of the coaches of what else can we do? How can we make our players better? So we emphasize we work with the pitchers first. And my main job is to work with them. Last year, we have some of those guys that played with us last year that are here today, and they can testify that the work that they do, and some of them became better throwers. I don't think we have any injury during the summertime. Most of them that were able to throw without difficulties, but some of the things that we do is elbow for them to help them how to use their lower half, which is their legs, and after that, we all talk about the kinetic change. So what is a kinetic change? Is basically how to use your foot all the way through your knees, your hips, your trunk, and then the arm. A lot of the kids, especially the younger kids, they use the arm only, and then they have a tendency to say that, oh, my arm is sore. Maybe I should run, maybe I should put eyes, but like some of those trainers say that if you have pain, there's an issue with your body, there's something that you're not doing correctly. My job is to make sure they're using their body properly. We do some medicine ball throws, we're trying to making sure they drive and they use the leg correctly. We do some stretching. Most of the time we throw between 10 and 5 minutes. We don't try and throw too much, especially during the off season. After we finish the throwing and doing those mobility works and the strength and conditioning part, Kyle is pretty much the one who emphasized and start doing with the program of lifting. When we're done with the lifting, we do some mobility work where they're focusing on their hips, anything that they have issues. So we can do that as a group, but if the player has an issue individually, Kyle normally talk to them and they put them aside and say, okay, this is what you have, this is your problem that you have right now. Let's tackle that, let's making sure that you can move properly. If the player has a pain, we normally don't like to make sure they don't throw. Then the only throw that we use is a 2-pound medicine ball. And the only way I use that is because I was able to learn that from a guy out of New Orleans, and he taught me that you don't put so much stress in the arm when you use a 2-pound balls with 2 arms. And that's some of the things that I was able to learn from him. And that's one of the things that I'm able to use with my players right now. They have, most of them, we started working with infielders, and right now we have a catcher, and he came in throwing at 62 miles per hour. That was during his first phase. Right now, this is our last week, he's right now throwing 75. So some of the things that we do is because we know that we can help those players and they can help themselves to prepare so they can become better athletes. And that's our priority. And last thing I would say, I've been working from youth side for the past 5-7 years, and by far YBC has been the only place that I noticed that they're partnered up with Boost, where Boost basically help the players to become better athletes. And that's our main priority, just to help them to be an athlete first, become a baseball player then. That's what we're trying to do, and that's what our main focus should be right now.
All right, next, Dr. Key, why we're all actually here.
As a team.
Start the show.
I don't know about start a show.
So, my name is Dr. Vincent Key. I'm an orthopedic surgeon. I primarily specialize in knee surgery, shoulder surgery, elbow surgery, at KU Med. On my spare time, and I do mean that on my spare time, I'm the medical director, head team physician for the Kansas City Royals. What does that mean? Because I tell people introduce me as that, and they're like, oh, you take care of the Royals. Oh, you take care of the Major League guys. No, I take care of the entire organization. I got 10 teams I'm responsible for. 2 Dominican teams all the way up to the Major League guys. The biggest thing, and I'm going to tell you guys, is this, and I'll start from a parent's perspective. I have 4 kids. I have 3 boys, I have 1 girl. Actually, my girl may be my best athlete. But my house, when I first started, I stopped playing baseball in 8th grade. Why? Because I was left-handed, I could throw hard, and they just pitched me to death. And I was throwing a cutter. I didn't even know what I was throwing. And kids couldn't hit it. They just flat out couldn't hit it. I can't tell you how many no-hitters I threw. And just pitch, 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 pitch. And I got to the point, during the summer of my 8th grade year, I couldn't throw 30 feet without my arm hurting. And I just stopped. I stopped playing. Fast forward into my kids. I have 2 sons who play college football. One at Kansas State, one at Northwest Missouri State. And then I have my sophomore son at Bishop VA who's my baseball kid. And he loves to play baseball, that's what he likes to do. My daughter runs track. So I'm saying all this to say this, is that I'm not gonna say anything here that I would not say in front of my kids, because your kids are my kids, and that's just the way I look at it. People talk about me being, oh, you're the team doc for the Royals, so you're busy. You're very busy. I'm never too busy, okay? So if you needed to call my office for something, call my office. If you need to come in and see me, you come see me. You have a good group here with the folks at Boost, and I can say that because I've basically been from the ground floor. When Travis and he would call me and he was telling me, he was my trainer in arena football. So I'm gonna start out with this. How many pitchers do we have tonight? Raise your hands. Okay. Okay. And how many kids in here just play baseball? Baseball only. Please find another sport. I don't care what it is. It can be bowling, it can be golf, it can be something else. More's not better, smarter's better. Okay? A couple people in here, especially you know that you've dealt with me before. Okay, so it's going to be monotonous to you, because and you can kind of back me up on some of this too, right? Okay. I get kids that come in my office all the time with shoulder and elbow pain. And the first thing everyone jumps is, I kind of go over history with them. Well, what were you doing? How did when did you first start having the pain? Well, I was throwing, and it started hurting, but it wasn't that bad, okay? And this is the one thing about kids all the time. They try to minimize everything, okay? To me, it's pretty black and white. Either you're having pain or you're not. And then I go down the line to trying to figure out, well, what type of things were they doing? And here's the scenario most of the time. You have pain in your elbow. You say something to somebody, you say it to your coach, you tell your parents or whatnot, what happens? They shut you down, right? Stop throwing, okay? You feel better, right? Most of you guys, it takes about a week, feel better, right? Then you go back to throwing again. Starts hurting again. It's not as bad as it was before, but it still hurts. So then what happens? Shut you down again. And then maybe a week, maybe 10 days, feel better again. Then you go back to throwing again. And what happens? Pain starts. And I hear this over and over and over again. The problem is that you have a hole in your boat and you're scooping out the water and you're not dealing with the hole. Okay? And the hole starts at about 13 years old. And what do I mean by that? I mean that you have to, like you said, you have to get yourself ready to throw. Why? Because once you hit about 13, you hit puberty. And what happens to the forces on the shoulder and the elbow? They go up exponentially. They go way up. Okay? So when you're 10 years old, you can fall out of bed, and most of you guys at this level now, when you were 10 years old, you were probably the best guys on your team. You can get out there, especially pitchers, and you can just gas everybody. No problem. But what happens when you hit 13 and you start getting bigger, those forces become real. And those forces can be bad enough where you start having the pain. Okay? Does anyone know who invented the Tommy John procedure? Dr. Frank Joe. He's in Los Angeles. I actually had the opportunity, I trained in Los Angeles. I'm from Kentucky originally. But I was actually the last resident to work with Dr. Joe before he retired. And so from dealing with Dr. Joe all the way up to dealing with these guys, you learn a lot. The one thing that people talk about in terms of the Tommy John procedure, and I'll talk about another procedure here pretty soon because I'm actually going to do one tomorrow on a kid, is that the myth is that you throw better after a Tommy John procedure. Okay? So you actually throw better because you fix the things that have caused it at the beginning. All right? So And you get some guys who get the two-time offenders. Okay, they've had 2 Tommy Johns. Well, why did they have 2 Tommy John surgeries? Well, they acted like I was a mechanic, right? I just put a new ligament in the elbow. But they didn't fix the thing that caused it to begin with. If you don't fix it, then all they're doing is putting the same stress on a reconstructed ligament. Okay, so what's the difference? The difference is that those guys were talented. They fixed their kinetic chain problems. And you got to hear it say over and over the kinetic chain, and now they're able to finish. When you have a Tommy John procedure, your chances of returning to your pre-injury level are 80%, 80. It's not 100. All right, so back to the kinetic chain stuff. One thing that I see that's the big deficiency in a lot of these kids is their shoulder and their shoulder blade and their lower half. And I can say for a fact, because I have 3 boys in my house that really don't work on it, that none of you guys work on your lower half at all. You guys don't even know what a hamstring is half the time. None of y'all stretch at all. Because I asked, well, what's y'all's pregame routine? Oh, we go over to the wall and we take the bands and we do this. That's all we do. And the other 90% is them stretching, getting their scapula right, getting their lower half right, and all of that stuff. That's the other 90%. And that's what's going to get you over the hump. Okay? So it's really working on those things. Everyone tries to find, like I said, we talked about velocity, right? So, I'm going to hold this for a second. All right. So, he's left-handed, okay? So, you know what we're going to do, right? Okay. Thumbs down. Push up against my 2 fingers. Push. Good. Push again. Push. See how strong he is there? Okay? Push. Push. And he's left-handed. So he should be stronger on that side, right? Right? Yeah. Okay. Watch this. Thumbs down. Push. Look how much stronger he is. Does anyone know why? I know he knows. Does anyone know why? It's shoulder blade. Turn around. This. 1/3 of your shoulder motion comes from your shoulder blade. Did anyone know that? Okay? 1/3 comes from here. So it's just like you having a, guys, it's just like you having a 9-cylinder car and you're running on 6 cylinders. If this isn't right, think about how much your velocity would increase if you just strengthen your scapula. Okay? The other thing is that a lot of guys get tight right here, or they get tight back here, right? And soreness, and I'm gonna go back a little bit and talk about soreness, because throwing is not a normal motion. Okay? So guys get sore all the time. The question is how long are you sore? For me, if you're sore more than about 36 hours, 48 hours, that's not normal. Okay? That's not normal. I expect some post-throwing soreness. Okay? But if you start getting real tight back here, or hurting back here, and tight right here, that's because your posterior capsule is very tight. Does anyone here know what a sleeper stretch is? Okay?
Yeah.
Do you do them?
I had to do it as boost.
I'm not. Do you do them?
No, not anymore.
Why?
I don't know.
Ah, good answer. I'll give you that. Because you thought it was a rehab thing, right? You have to do it. You have to own it. You have to do those things to get yourself better. It's not a rehab thing. It's a prehab thing. It's something to keep you out of trouble. Okay? And the problem with kids is that they want to see something, right? They want to get something out of it. They want to touch it. Okay? You can't touch prevention, bro. Can't touch it. I get on my son. My son's an outfielder. He came home during this last summer. Oh, Dad, my shoulder. I said, you doing your sleeper stretches? No. Go on upstairs. I don't want to hear it. Because he knows. It's not a rehab thing. It's a prehab thing. Okay?
So you have to, you just have to own it. Okay? Now, other things that I talk about with kids, and some of this is kind of newer stuff. One thing that we're looking at are things like vitamin D levels. One thing that we found in kids, at least I found, is that they're vitamin D deficient. A lot of kids. And people say, well, they're outside all the time. Well, they're outside with sunscreen. Okay, so they're not truly continuing it this year. We supplement all of our players with vitamin D. And it comes in international units, either anywhere from 2,000 to 3,000 international units per day. Okay, so we have them take that. Now I'm going to go back and talk about elbow, okay, because it plays into it. Here's what happens. Kid's elbow starts hurting. Why does the elbow start hurting? Well, their kinetic chain is bad. Their posterior capsule is bad. Their scapula is bad. Their internal rotation of their opposite hip is bad. We just talked about hips, right? So pitching is a winding top. So if your internal rotation of your hip is bad, where are you trying to find your velocity? You're trying to find your velocity in your shoulder. If your scapula is bad and your posterior capsule is bad, then where are you trying to find it? Here. Okay? My dad was an accountant. So for me, it's like a bean counter. You only have so many clicks in this elbow before something happens. Okay? Whether it be the ligament, whether it be the bone, or whether it be both. Okay? I can't tell you how many screws I put in elbows this year. A lot. I had a run of at least 2 or 3 a week for about 4 or 5 weeks. Okay? So, if this normally, 1 click every time you throw, okay, is 1 click. Okay? If your kinetic chain is bad, every time you throw, maybe 2 or 3 clicks. Okay? And you only have so many. Okay? So why not do the things to take your stress off your elbow? Okay? Take the stress off the elbow. What I was about to say is talking about warm weather versus cold weather climates. Okay? Do you know where the best pitchers come from?
California.
Texas. If you look in the history of baseball, the best pitchers come from cold weather climates. Why? Because they don't throw all the time. Okay? Your best hitters come from warm weather climates because they hit all the time. Okay? Here in Kansas or Missouri, you guys are at a disadvantage of the guys in California and Florida and so forth. Because here's what happens. Your shoulder starts to hurt, or your elbow starts to hurt, okay? And you don't necessarily want to be shut down, so you're holding on to it. You know, don't tell anybody, blah, blah, but it gets to a point where you have to say something, right? It just hurts so bad. So what happens? They come and see me. I look at them. Posterior capsule's bad, scapula's bad, hamstrings are bad, core is bad, everything is bad, and your elbow hurts. So what do I have to do with them? I have to shut you down. Okay? And it's not shutting down for a week. Okay? It may be shutting you down for 3 weeks. Okay? So when I shut them down for 3 weeks, and this is kind of a little dirty little secret, so if you guys look at guys that are on the disabled list or something like that, this is kind of a rule of thumb. Every day down is a day in the throwing program. So if I shut you down for 3 weeks, okay, that doesn't mean the 4th week you're throwing like nothing ever happened. You're back in the game. No. Okay? Because we shut you down from throwing for 3 weeks. Okay? That means what I call active rest. That means we're starting to fix the things that cause the problem. So you're doing your stretches, you're doing your core, you're doing all that stuff. You're just not throwing. Okay? So then we got to get you up on a throwing program because we have to get your body back to throwing to adapt to throwing. Okay? So if I shut you down for a 3-3, you're not pitching in a game for about 6 weeks. How much of that season have you lost? Right? Because you only play how many games in a high school season? How many games do you play? You go to Blue Springs. Huh? 20-something. Right? So if you're down for 6 weeks, how many games have you lost? A lot. What does that mean? You have to do your work now. Okay, because how long does it take to stretch this capsule out or start to stretch the capsule out? About 6 to 8 weeks. Okay? And not everyone has, if your elbow hurts, not every hurt elbow means that you're going to have Tommy John surgery. It may mean that you have what's called valgus extension overload, which is a bone issue. Talked about the vitamin D, where it's just so much throwing. You're going from here to here, and your bone doesn't like that. Okay? And eventually, in some people, it can cause stress fractures. And I'm sitting there putting a screw in their elbow. Okay? Why is that? Because their bone is bad, and their kinetic chain is bad, so you have increased force on bad bone. Bad mix. Okay? So, how do you get out of that? You give yourself time for your body to adapt. Okay? You give yourself time for your body to adapt. All right? So all these things, like I said, are important. So when you talk about, thanks Trav, when you talk about kids who are 13, 14, 15, 16 years old in that neighborhood, the ligament is actually tougher than the bone. So what fails first is the bone. You pull the bone off. Okay? I just got through taking a screw out of a softball player today, matter of fact, that I put a screw in her elbow. She threw, felt a pop, she pulled the bone right off. Put it back, Humpty Dumpty, put a screw in, all's good. Okay? As you age and mature in that growth plate, because you have a growth plate sitting here, as that growth plate closes, now the ligament fails first before the bone. So that's the difference between the two. Okay. The other thing you can look at in terms of the ligament itself to know whether or not the ligament is failing are a couple things when I analyze patients. Is that I say, okay, how's your velocity been? Okay. How's your command been? Okay. And those two things are the things that I look for in terms of a failing ligament. And a lot of times with these kids, the ligaments aren't failing, they just need to back off a little bit. Sure, can we get an MRI? And I don't sit there and just jump to an MRI, okay? Because everyone's like, just get an MRI. It'll tell you everything. No, it won't. Okay? So let's bust that myth. Okay? Because that's what everyone jumps to. Get an MRI. Did it? Get an MRI. Did it? Shoulder. Get an MRI. Okay? Because I can tell you with these kids, I can tell you everyone in this room that's probably over, I'll be 52 on Friday, I can tell you everyone 45 years or older in this room has probably a partial thickness tear of the rotator cuff. Okay? Okay? I got 3 $100 bills sitting here that I would lay on the table. Okay? So when these kids have their elbow problems, it's not just rushing to get an MRI. Let's actually touch the patient. Let's actually examine the patient. Let's actually talk about these things, because ultimately it's going to be the things that we talk about that are going to help you the most. Okay? Now, if you feel a pop and that thing is swollen, that's a horse of a different color. Okay? Or this thing has been going on for a while and your velocity's starting to drift and your command, you don't know where the ball's going, that's a different problem. Okay? And I can probably tell you, most of these kids in this room don't have that problem. Their elbow may hurt, but they don't have that problem. Okay? And so when I deal with major league guys, that's what I deal with. First thing I ask about is their command and their velocity. Okay? So, same way with the shoulder. Most of these kids have some shoulder pain. It's because their growth, a lot of these kids still have their growth plate open. So they're stressing their growth plate. Okay? It's not a rotator cuff. Okay? Let me say that again. It's not a rotator cuff. If you have a child with a full thickness rotator cuff tear, please bring him to me so I can write him up in the journal. Because that's where he's going. It doesn't happen. Let me be clear with that again. It doesn't happen. Now they can have partial tears of their cuff or a little scuffing of their cuff, but the reason why they have that scuffing of their cuff is because this capsule is very tight, and the ball, which usually sits center in their shoulder, rides up and to the back. So what do? They pinch their cuff. So they start getting pain, like I said, here. They start getting it here. And because the ball is going that way, what's called your biceps tendon sits in a groove, you put your biceps on stretch. So this starts hurting. Does that sound kind of familiar to some of y'all in the room? Yeah. Yeah, he knows. Yeah, I already know. Yeah, me, I already know. Okay? But this is, I'm just telling you guys, this is, it's not like I'm Nostradamus or something. I see this all of the time. So I'm going to go to the other end talking about surgery, okay? Because people ask me, well, I mean, what do you do? What you know, Tommy John surgery? I probably do more Tommy Johns probably anybody in the city, probably. That's not a badge of honor. It makes me sick, actually, okay? Because everyone talks about there's an epidemic of Tommy John surgeries. There's not an epidemic to some degree. It's like the chickens coming home to roost. So when I talk about doing the surgery, I take this little tendon right there, here, here, and here, and put it here. That's what a Tommy John surgery is. Drill a tunnel here, dock it here, boom. So what does that mean for a patient? That means that you're not even starting a throwing program for about 22 weeks. That's about 5 months. When you talk about Tommy John surgery, how long does it take for a kid to come back, or one of my professional guys to come back from Tommy John surgery? About 12 to 14 months. How long is it before they're really good, though? They can come back at 12 to 14, but they're really good at about 2 years. Because all sports are timelines. Because what do you parents ask me? When can they be back? Well, what's the timeline of them being back? Okay? I think that's the difference between me and other people that don't deal with overhead athletes, is that I map out, getting you into therapy. How long are you going to be in therapy? When are you going to start to throw? If you're a hitter, some of you guys pitch and hit. Well, when are you going to start batting? It's all of those things. So that's something that I really concentrate on in my office. I have myself, I have a trainer, I have 2 nurses in my office, and a PA. And so those are the things that we really concentrate on with the athletes, okay? And my office is not cookie cutter at all. It's tailored to whoever's sitting in that room, okay? Because everyone's different. As we were talking about arm slots. Everyone said, well, did he hurt his elbow because his arm slot? No. You have to, a lot of times in terms of arm slot, for me, it's getting your body ready to meet you at whatever arm slot you're at. Now, there's some funky deliveries and funky pitching, that you're like, kids are really whipping a lot. Why? Because they haven't fixed anything, okay? And so the thing is for me, is trying to analyze a kid where they're at. So for me, that's you guys' job. I don't get into a lot of arm slot stuff. Honestly, I don't care to some degree. I don't care. What I do care about with your child is, hey, are you doing your sleeper stretches? Hey, are you doing your hamstring stuff? Hey, are you doing your scapula stuff? That's the stuff I care about. Because that's the stuff that's going to keep you out of my office. And I don't take offense if you don't come back to my office and you're doing well, great. That's what we're here for. Okay? But, the main thing with you guys, with you athletes, you have to own this stuff. You can't depend on them to do it for you. Okay? That's why I asked when you said that, I said, what do you do? Not what they do. They're there to help you, but they can't be with you 365 and a quarter, 24/7. Okay? When you're in the off season, like during the season, these exercises that I get the kids to do, they have to do it 100% during the season. You have to pay to play. During the off season, I say you only have to do it about half as much. Because if you don't do it during the off season, guess what happens to that tissue that you stretched out? It tightens up again. Okay? That's why I like doing other sports. Because you can cross-train a lot of this stuff too. And keep limber. And keep flexible. And things of that nature. So that's why I say, and when Royal Scouts, because I do coaching. I coach a lot of kids. You know what they ask me? They don't ask me do you know any baseball players? They don't. They asked me, who's your two-sport kids? And I understand, you know, we're in the age of more is better. More is not better. Smarter is better. And that's what you guys have to understand. Smarter is better. If you want to get to the next level, if you want to get to college, and here's the funny thing, all this stuff that we're talking about, if you grab a hold of this stuff, when you get to college, you actually have an advantage over your teammates. Because I can guarantee you, your teammates probably don't know this stuff, your coaches don't know this stuff, and lo and behold, I'm going to say it, your trainers may not know this stuff, okay? And while those kids are struggling, shoulder hurts, elbow hurts, you're just trucking along. And here's what's funny, they'll come to you and ask you, well, why aren't you hurting? Because you're doing your work. You're doing your work. So that's all I got. I know I went way over time.
No. We appreciate it. Travis, you sure you don't want 5 minutes?
The only thing I'd say is the reason that we're partnering with Jeff and people like Dr. Key and Kyle doing this training is the fact that we're trying to get people that know what they're talking about and direct you in the right direction. Okay, people that, because if you go see some doctors, you go see some trainer or physical therapist, and you show up with a shoulder problem, all they're doing is working on their shoulder, and all the things you heard there, it's usually much greater than that. There's more to it. The shoulder is a victim to everything else.
I don't even deal with that. Like when a patient will come in and their elbow's hurting, that's the last thing I examine. Really. They're like, it's my elbow. I know. I want to say one last thing though, because I don't know if you're in club. Who in here has done weighted balls? Raise your hand.
Not here, they don't.
I figured that. Okay. Weighted balls. Weighted balls aren't a bad thing, but weighted balls with bad kinetic chain is lethal. Lethal. Okay? Because you got weighted balls, okay? You're going to have an uptick in your velocity. Of course you are. You're going from something that weighs 10 ounces, you know, baseball weighs 5.5 ounces. Okay? You're throwing something 10 ounces, of course you're going to be able to throw harder in a short period of time. You're not going to be able to maintain that. It ain't going to happen if your kinetic chain isn't right. Now, if you have a good kinetic chain and you do a weighted ball, A, you'll probably be able to get through the program without breaking. And B, your velocity will tick up just a little bit, but your velocity will tick up a little bit if you do the kinetic chain work. Okay? All right? Okay. Weighted balls in an underdeveloped kid is lethal. So you have to show first that your body is ready to do it before you do it. Because you just doing it ain't gonna help. So I just want to throw, that's a PSA from me. Here's the thing. I like to start from here down. Okay? So the kinetic chain is this. Posterior capsule. Okay? Your scapula. Your core. Your hip. Especially the opposite hip to the arm. Your hamstrings. Okay? Some kids have their hips. There are some kids that have bony blocks in their hips, what's called FAI. And sometimes if you're just struggling in terms of your range of motion of your hips and you just can't get it, you better go to your pediatrician and at least get an x-ray. Again, don't get an MRI. Get an x-ray. All right? Because we have some kids that just don't. They just can't. Okay? But that's what it is. That's it. All this stuff is not esoteric. It's pretty daggum simple. It's just being willing to learn and being willing to accept. And understanding it's not going to be a short-term fix. Everyone wants something that you'll be good in a week. You're not going to be good in a week. Okay? But if you start on this, especially your pitchers now, you guys should be doing this stuff, hammering this stuff. Okay? To get yourself ready for the season. Okay? Because again, how long does it take for that capsule to get stretched out? 6 to 8 weeks. Okay? You got time now. It's getting short, but you got time. But if you stay consistent with it, you do it through the season. It's not, okay, I'm in the season, I'm good, I don't have to do this anymore. You still have to do it through the season. Because guess what happens through the season? You hit the wall at some point, you start getting fatigued. Okay? There has to be a time, like I said, that you guys don't throw. You know, from that fall ball till, you know, sometime, I like at least 6 weeks of no throw. 6 to 8 weeks. Don't even pick up a baseball. Okay? Work on your kinetic chain stuff. Still do your stretches about half as much, but don't even pick up a baseball. Okay? You have to give your body a rest. Here's the last thing I'll tell you. Kids who play baseball, and this study just came out, kids who play baseball 8 months or more out of a year run a 5-time higher risk of injury than those who do not. Okay? Don't want to be a statistic. So, any other questions? I'll open it up. I know I've talked a long, long time. I'm very passionate about it because I care. Okay? I can only speak for me. I care about your kids. You know, I want them to be their best. I want them to get out of your pockets. Okay? Hey, get something. You know, there's hardly any full ride baseball scholarships. I hate to bust y'all's bubble too. Okay? If someone's on you getting a full ride baseball scholarship, you're probably getting drafted. Okay? You're probably getting drafted. My son, my sophomore son, he told his older brother, he said he ain't even going to college. He said he's stealing bags and hitting bombs. That's what he told Rajah Davis. Rajah Davis like, really? You gonna take my job? Carson's like, I'm gonna take your job. So, and like I said, for me, stretching is every day, strengthening is every other day or 2 days in between. That's my philosophy about that. It just depends on how you're gonna, are you gonna do it, what's called a dynamic warm-up. Okay? And depending on, depending on if it's cold, it's depending on the weather too. I was a track guy. I ran track at K-State. So for me, when I coach my kids, you know, is getting that dynamic stretch in before we do other stuff. Sorry.
Doctor, I have a question.
Yeah.
What's some of the issues or problems that you guys facing at the professional level, and what are they, and how can us as an organization make those guys better too?
It's the same stuff. I'm telling you, it is the exact same stuff. It's getting the players to own it. It's getting them to understand why they're doing it. Because again, they can't touch, they can't touch it, But it's just understanding to do those little things. Those little things. You have to pay to play baseball. You have to pay to play. If you're gonna, and some of those people that want to do baseball all year round, okay. But if you're gonna do baseball all year round, you better be doing this stuff all year round. Tell you that. Okay, you can't get rid of it. The only time you get rid of it is when you stop playing. Stop playing.
Can you talk to them a little bit about nutrition, how important that is for them?
Nutrition, a big thing that we've been talking about too is sleep. Sleep is important. Okay, I got everybody down in my basement playing video games right now. Fortnite all night. Okay, I got them down there. Fortnite all night. Okay, sleep is very, very important. It does affect your performance. Nutrition does affect your performance. Okay, you can't just try to eat right 3 days before you're gonna do something. It doesn't work that way. Okay, or just like if you're dehydrated, if it's hot. Okay, I'll give you a little trick. If you know that you're going to be in a hot environment, when should you start hydrating? When should you start hydrating? If you're going to play on Friday, when should you start hydrating?
Friday before.
Friday before. Thank you.
Better know that answer.
Friday before. I'm a big Pedialyte guy. I'm a big Pedialyte guy. Okay, just not slamming water, because all you need to get some electrolytes. My kids play football at Bishop Miege, and before I got there, they had guys cramping all the time. Grunhard would talk to me about it. He goes, "Man, Doc, what can we do?" Da 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 da. I said, "Look, man, here's what you do. If we play Friday, that Friday before, drink 1 bottle of Pedialyte every day. And after we started doing that, cramps stop. Okay? Because if you learn it at this level, the Tommy John surgeries are going to go down at the upper level, right? Because you're going to know what to do to get yourself there. You're going to give yourself a chance to get yourself there, right? Being able to be smart about, and when we talk about pitch counts, and I can't remember, does Missouri have a pitch count or not? I know Kansas does that.
It's like 110.
Okay. Is it 110?
Something
Okay.
like that.
Here's the other thing. When I talked about clicks here, clicks to me mean this: games, warm-ups, playing catch with your friends, pitching coaches, all of that stuff counts. Everyone tries to focus on, well, you only pitched 80 pitches. You only pitched 80, why? You only pitched 80. You know, it's volume. Everything counts. Everything counts. Every time you throw a baseball, it counts. And there's a big thing now talking about, well, do you ice afterwards, do you not ice afterwards, so forth and so on. Here's my thought. Throwing a baseball is an inflammatory event. Ice. All of our guys ice. Now, some of the guys may flush, they may go and just do a cool down, jogging, just to kind of flush them a little bit. Other guys have their own stem units. The stem units now are pretty cheap now, where some of the guys have their own units. A lot of our pitchers have their own units. Heck, I actually bought a couple for my kids who play football. Their own stem units that can help with that. Next day, it just really depends on the player. Some guys like to throw the day after, some do not. Okay? But I think right afterwards, icing, a good flush, and that's about it. How many of you guys long toss? Okay. Why do you long toss?
To loosen up my arm.
Just to loosen it up? Okay. I'm not, it just really depends. Again, I'm being pretty opinionated here. I'm not a big long toss guy. Okay, why? And this is why. It's a kinetic, it's a physiologic thing. When you move your shoulder like this, okay, you have different muscles firing different patterns along the arc of motion. So there are different muscles firing here, that are firing here, that are firing here. Okay? So, when you throw a ball at 90 feet, okay, where's your release point? It's there, right? Once you get to about 120 feet, where's your release point? Here. Do you pitch up here? You better not, you won't be on the team. Okay? All right? So you're teaching muscles here that you should be pitching, that you should be here. Different muscle firing pattern here than here. Does that make sense to you? In terms of that. You'd be better off throwing on a line at 90, 120 than to try to throw 220. Unless you're an outfielder.
Well, I'd like to thank you for coming. Really a lot of good information. I also am really, really glad that I encouraged two-sport guys. It would be really bad if I was like that guy who was like, just play baseball. I'm also glad we don't really do long toss. I'm also glad we don't do weighted balls, so it worked out pretty well.
You're the man.
Today I'm the man. Tomorrow it's a different story. Look, the big thing that I wanted to kind of take out of that Dr. Key kept saying over and over again, overworked and undertrained. And there's a lot of you guys in here, pitchers, that are getting ready to get into a high school season and then the summer season and then the fall season, and you guys are pretty good. And so you're going to get overworked a ton. And that's the big reason why you need to really be on top of how you're going about getting ready to do that. Okay? We talk all the time about getting you guys in here, doing true velocity, getting trained, doing things the right way, because that training will carry you through. What we saw last year with our guys who did true velocity was the same thing he was talking about with between the lines. We just didn't have any injuries. Not only did we not have any injuries, we didn't even really have any pain. I mean, for all of our pitchers that went through that program last winter, we had healthy, happy guys. And guys that threw harder, which is an awesome side effect. But the little known trick here is they're going to throw harder just because they're learning to throw properly and they're learning to use their bodies in the right way. And we're not overworking their arm, we're training the rest of the chain all the way through. So, you know, the whole reason behind the program is exactly what he's talking about. As many guys as we can get into it, the healthier we're going to be. For you guys that are really getting ready to take on a heavy workload as far as pitching, or catchers, obviously, left side infield guys, It's vital, okay? One beautiful thing about doing the program is when you get done with the program, you always have the program. Like, we're always here if you want to do it again. Obviously, it's nice to have somebody standing over you telling you what to do, making sure you're doing things the right way. But you're not going to lose those exercises. You're not going to lose those stretches. You're not going to lose the knowledge that you gain that will hopefully keep you healthy for the rest of your careers. And I'm looking out at, I mean, you can look up on the wall. There's a lot of guys who went on to play college baseball. A lot of those guys continue to play. I'm looking at a bunch of 15 and 16-year-old guys that are going to be playing this game till you're probably 23. Almost all of you. If you're lucky enough to play beyond that, fantastic. But the bulk of you are going to play this game for another 5, 6, 7 years. What will keep that from happening? What's the one thing that cannot happen to you? You cannot lose that arm, right? If that arm stops, it's all over. So that was the biggest reason why we developed the program. We see guys going over and throwing weighted balls when they're not ready to throw weighted balls. We see guys coming back with blown up arms. We're trying to train you, but we don't have the time with you unless you join a program where we can focus on throwing mechanics and using the kinetic chain for that entire time and pair it with the strength and mobility work that you need to be able to do it the right way. So that's the reason behind it. I have a feeling like we advertise it, we talk to you about it, we talk to guys about it, but we don't really dig in, so you don't really understand how important we find it and you know how important we think it is. For the guys that don't do it, we're trying to train you. We're trying to do the mobility. We're trying to teach you the things that we're talking about here, but we just don't have the hours. We just don't have the time with you. In the program, we can kind of dig down and force it. Okay, so that's hopefully we're building the athletes that understand how to use their bodies, get ready to throw, and on top of that, they're just going to throw a little bit harder. Okay, preventing injuries is the big thing. We had 35 guys in the program throughout the course of last winter. Not a single one of those 35 guys had an arm problem. All of them, on average, threw 5 miles an hour harder. So again, beautiful ancillary benefit. Now, velocity's just increased so much over the years at the highest levels that if you're going to compete, if you're going to play this game for a long time, you're going to have to do it. You're going to have to get to a place where you have more velocity. If you're going to get to a place where you have more velocity, and you haven't figured out how to train your body to work through that and make sure that you're not hurting yourself and you're just blowing yourself up. Okay? Makes sense? All right. I appreciate everybody coming out. I don't want to keep you any longer. We've kind of been a long time, but thanks again to Dr. Key and everybody here.